Good day everyone, my name is Kyle Angeline Pioquinto from BSN 111G, and today I will be demonstrating vital signs, where we are taking the patient's blood pressure, pulse rate, respirations, and temperature. Vital signs provide is what an assessment for our general health. They alert us to early indications of an infection, guard against incorrect diagnosis, and motivate us to make wiser decisions. But before we get started, allow me to introduce the devices we'll need for the assessment we're doing today. To check the patient's temperature, we will need a digital thermometer, cotton balls, and alcohol to clean the equipment both before and after use. The BP apparatus, the stethoscope, which are used to check the patient's blood pressure, notebooks and writing materials that we'll use to assess the measurements of the respiratory rate and the pulse. Now, it is crucial for our equipment to be organized and accurate because it ensures our effectiveness as nurses. Let's assess the temperature. The temperature is the difference between heat produced and heat lost by the body and is measured through the use of thermometer. The first thing we have to do is to introduce ourselves to our patient, verify the patient by looking at their identifiers or their armband and having them tell you their name and their birthday. Also, tell the patient what we are going to do. This is to obtain the necessary data from the client, and when the patient knows what is to be done, he or she will cooperate better. So, ma'am, my name is Kyle Angeline Pioquinto, your student nurse for today. May I know what's your name?
My name is Kate Dayan A. Pitugo,
Your birthday?
December 15, 2003.
Okay, thank you. So, ma'am, we are going to check your body's temperature. Is it okay with you po?
It's okay.
Okay, thank you. After that, I will do my medical hand washing and I will don my gloves. This is to deter the spread of microorganisms. And next, I will provide the client privacy by closing the curtains or closing the door of her room and adjust the temperature of the room. Next, I will position the client in a sitting position to obtain her oral temperature. Next, I will rinse the temperature by using an alcohol swab, a firm twisting motion from the bulb to the stem. This twisting helps to come in contact with the thermometer's insured surface. So, ma'am, please open your mouth. I will leave the thermometer in place until signal or beep is heard. Okay, next I will remove the thermometer and tell the client his temperature. So, ma'am, your temperature is 36.7 degrees Celsius, which is normal. Next, I will rinse the thermometer by using an alcohol swab in a firm twisting motion from the bulb to the stem. This twisting helps to come in contact with the thermometer's entire surface. Okay. Next, I will move gown or sleeve away from arm and shoulder, and I will raise the arm away from torso and inspect axillary area for lesions or perspiration. Then I will pat the axilla dry, especially if very moist, and then place the tip of the thermometer in the center of the axilla and ask the client to lay arm over the tip and across his chest. And then I will turn the thermometer on. This is because moisture in axilla may alter the result of the temperature. The deepest area of the axilla provides the most accurate temperature measurement. Okay, ma'am, please. Then I will leave the thermometer in place until signal or beep is heard, allowing sufficient time for the axillary tissue to come in contact with the thermometer bulb results in a reasonably accurate measurement of the body temperature. Okay, ma'am. Your temperature is 36.5, which is normal. Next, I will wipe the tip of the probe thermometer sensor with an alcohol swab from stem to probe. In a firm twisting motion. Remove and discard my gloves if applied, and then perform hand hygiene. This is to deter the spread of microorganisms. And then next, I will record the temperature reading and worksheet, and I will check the temperature if the temperature is obviously too high or too low or inconsistent with the clients. This is to prevent the incorrect temperature reading. Then I will document the temperature in the client's records, for example, the VS monitoring sheet. Now, let's proceed to assessing a peripheral pulse. Pulse is a rhythmical throbbing that results from a wave of blood passing through an artery as the heart contracts. The first thing we have to do is to introduce ourselves to our patient, verify the patient by looking at their identifiers or their armband and having them tell you their name and their birthday. Also, explaining to the patient what we are going to do. This is to obtain unnecessary data from the client, and when the patient knows what is to be done, he or she will cooperate better. So, ma'am, I'm Angeline Pioquinto, your student nurse for today. May I know what's your name?
My name is Kate Dean Apitugo.
And your birthday?
December 15, 2003.
Okay, thank you. Is it okay to you, ma'am, that we're going to check your pulse rate? Okay, thank you. After that, I will do my medical hand hygiene. This is to deter the spread of microorganisms. Then I will provide the client a privacy by closing the curtains or closing the door and adjusting the temperature of the room. Then I will select the pulse point. Normally, the radial pulse is taken unless it cannot be exposed or circulation to another body area as to be assessed. Then I will assist the client to have a comfortable resting position. And now, I will place my two fingers in the client's inner wrist and then press gently against the radius, resting my thumb on the back of the patient's wrist. The fingertips, which are sensitive to touch, will feel the pulsation of the patient's radial artery. If the thumb is used to palpate the patient's pulse, the nurse may feel her own pulse. Using my wristwatch with a second hand, I will count the number of pulsations felt for 1 full minute. Sufficient time is necessary to detect irregularities or other defects. Then I will assess the pulse rhythm and volume. If the pulse rate is abnormal in any way, I will repeat the counting to determine accurately the rate, the quality, and the volume. When the pulse is abnormal, longer counting and palpation are necessary to identify most accurately the unusual characteristics of the pulse. Okay, ma'am? Okay? And now that I have obtained the pulse rate, which is the 80 beats per minute, and have a normal and regular rhythm. And then, I will document the pulse rate, rhythm, and volume in the client's record, which is the TPR sheet. Also record the nurse notes pertinent related data such as variation of pulse rate compared to normal for the client and abnormal skin color and temperature. And now I will perform the hand hygiene. So now let's proceed to the respiration. It is the exchange of oxygen and the carbon dioxide between the atmosphere and the body cells and is initiated by the act of breathing. To obtain the respiratory rate per minute and an estimate of the patient respiratory status. The first thing we have to do is to introduce ourselves to our patient, verify the patient by looking at our identifiers or the armband and having them tell you their name and their birthday. Also, tell them or explaining to the patient what we are going to do. This is to obtain the necessary data from the client, and when the patient knows what is to be done, he or she will cooperate better. Okay, ma'am. So, my name is Angeline Pioquinto, your student nurse for today. May I know what's your name?
My name is Kate Belen Epitugo.
Your birthday?
December 15, 2003.
Okay, ma'am. Thank you. So, now we are going to check your respiratory rate. Is it okay with you, ma'am?
Okay.
Okay, thank you. After that, I will do my medical hand hygiene. This is to deter the spread of microorganisms. And then I will provide the client's privacy, the closing the curtains or closing the door, and adjusting the temperature of the room. So now, using our watch with second hand, I will count the number of respiration for 1 full minute. While doing this, I will observe the depth, rhythm, and the character of respirations by watching the movement of the chest. A complete cycle of inspiration and expiration constitutes the one act of respiration. Sufficient time is necessary to observe rate, depth, and other characteristics. So, ma'am, okay, ma'am. Your respiratory rate is 16 beats per minute. You have a labor and a regular breathing. After that, I will document the respiratory rate, depth, rhythm, and the character on the appropriate record. The next, I will perform the hand hygiene. So now, let's proceed to the blood pressure. Blood pressure is the lateral force exerted by the blood on the arterial walls. First, I'm going to ensure that the equipment is intact and functioning properly. Check for cuff size, leaks in the tubing between the cuff and the sphygmomanometer. Using a faulty equipment or using a blood pressure that's too large or too small can give you inaccurate blood pressure readings. In my case, I already checked my equipments. The first thing we do is to introduce ourselves to our patient, verify the patient by looking at their identifiers and their armband, and having them tell you their name and their birthday. Also tell the patient that what we are going to do. So, ma'am, I'm Kyle Angeline Pioquinto, your student nurse for today. What's your name?
My name is Kate Belen Epitugo.
Your birthday?
December 15, 2003.
Okay, thank you. So now I'm going to measure your blood pressure. Is it okay with you?
Okay.
Okay, thank you. After that, I will make sure that the client has not smoked a cigarette, ingested beverages that contain caffeine, or has had any strenuous activity within 30 minutes. Nicotine causes vasoconstriction in peripheral and coronary blood vessels, which may cause increase in blood pressure. Caffeine is a stimulant that increases blood pressure. Strenuous activity also increases blood pressure. Then I will determine the best side arm to use. It's the best take to blood pressure in the non-dominant hand, which is the left if the patient is right-handed. Ma'am, are you a left or right-handed?
Right-handed.
Okay, thank you. I will position the client appropriately. The adult client should be sitting unless otherwise specified. Both feet should be flat on the floor, and the palm and the hand facing up and the arm supported at heart level. I will then expose the upper arm. This position exposes the bronchial artery so that the stethoscope can rest on it conveniently on the antecubital area. Then I will place the cuff. The size inflatable bag is centered and is lies midway over the anterior surface of the bronchial artery. The surface of the bronchial artery should be at the center of the two tubings of the cuff. Pressure applied directly to the artery will yield most accurate readings. Okay, ma'am, your arms. So now, I will use my two fingertips to feel a strong pulsation on the antecubital space. Accurate blood pressure reading is possible when the stethoscope is directly over the artery. And then deflate the cuff. So I already taken the estimated systolic pressure, which is at 110 millimeters of mercury. As for the actual taken of BP, I'm gonna need to inflate the cuff for about 30 millimeter mercury higher than the estimated systolic. Okay, ma'am? Then I will position the stethoscope appropriately. Okay. Cleanse the earpieces with antiseptic wipe. Insert the ear attachment of the stethoscope in your ears so that they tilt slightly forward. I place the diaphragm on the amplifier of the stethoscope over the brachial pulse site. Place the stethoscope directly on the skin, not on clothing, over the site. Hold the diaphragm with the thumb index finger with the rest of the finger supporting the elbow. Then I will auscultate the client's blood pressure. Pump off the cuff until the sphygmomanometer reads 30 millimeter mercury above the point where the brachial pulse disappeared. And I will deflate the cuff. Release the valve on the cuff carefully so that the pressure decreases at the rate of 2 to 3 millimeter mercury per second. As the pressure falls, identify the manometer reading the Korotkov phase 1 systolic BP. First first stopping sound heard during deflation of the cough. Chronic cough phase 4, first diastolic BP, the first time when the sounds become muffled and have a soft, blowing quality. And chronic cough phase 5, second diastolic, the pressure level when the first last sound is heard. This is followed with the period of silence. Will prevent you from the missing first stop sound as the result of the auscultatory gap. So I have already obtained the final blood pressure, which is 120 over 80, which is normal. Next, I will remove the cuff off from the client's arm. Then I will wipe the cuff with an approved disinfectant. I will document and report the pertinent assessment data according to the agency policy. This is to take note the findings as a record. So Miss Diane, upon taking your vital signs and your result shows that it is all normal and you don't have to worry because I will monitor you from time to time. So do you have any concerns or clarification, Miss Diane?
No po.
Okay, thank you. Thank you so much for your time and cooperation, Miss Diane, and have a nice day.
Thank you.